Hey, what's up? This is Corey Dion Lewis, founder of Healthy Project Media and the host of the Healthy Project podcast. Join me as I speak with change makers who are doing the work and sharing their stories, insights, and innovations to close gaps in healthcare for everyone. Hello, everybody. Thank you for listening to the Healthy Project podcast. I am your host, Corey Dion Lewis. Today, I have a great guest with me talking about having this conversation that needs to be amplified. We need to be talking about more because it is going to affect a lot of people in our community, and especially the communities that we're serving, those under-resourced and underserved. I have Sister Mary Haddad here with me today. Sister Mary, thank you so much for being here. I really appreciate it.
It's a joy to be with you, Corey, and thank you for all that you do to highlight these important issues.
Yes, we have to. So before we start really getting into the conversation, can you tell the people a little bit about yourself, who you're here representing, and what I would love to know what gets you up in the morning.
Sure. Well, what I was going to start with by saying maybe this is why I get up in the morning. Corey, I'm a Sister of Mercy. I'm been in the community for just over 40 years, so I have a long history of working in a variety of different capacities in education, in social work, and now in healthcare. I am the president and CEO of the Catholic Health Association of the United States. I've been serving at CHA since 2009 and have been in this role since 2019, right before COVID. And we represent Catholic hospitals, Catholic clinics, health systems, long-term care facilities across the United States. And Corey, I would want the listeners to know that I think what's important about Catholic healthcare is the long, rich tradition we have of serving in this country. We actually, kind of pinpoint our foundation in 1727 when the first sisters arrived from France into New Orleans. And, we have a history, this long legacy of caring for people who are poor, marginalized, those who are uninsured. And we care for 1 in 7 patients in this country. Many of those are on Medicaid. And so we represent, a very large footprint of healthcare in the United States.
Wow, there's a lot of work to be done there. So I appreciate you being in this position.
Absolutely.
I know a lot of people have heard about these proposed Medicaid funding cuts, but they don't really. I don't think a lot of people really understand. Can you give our listeners kind of an overview of the proposed Medicaid funding cuts?
Sure. Corey, let me start by first saying that people don't always understand. Medicaid is a joint state and federal health program, unlike Medicare. All right. So I think it's important to know that. And I would say it's more than a health program. It really is a lifeline to so many people in order to ensure their, flourishing in their communities. It provides access to care for those who need it most, the poor and the vulnerable, pregnant women, elderly, disabled, and always by ensuring their dignity. So I think it's really important we understand that 1 in 5 people in this country actually are on Medicaid. Half of all children in this country are on Medicaid, and 41% of all births in this country are covered on Medicaid.
Wow.
So when we start, it's phenomenal when you really look at the large impact in the population this will affect. So when we talk about these funding cuts, there are a variety of different ways that Medicaid will be impacted. It's going to, just general comment, all of these cuts will potentially lead to a decrease in access to healthcare services and an increase in the uninsured population. And remember, since the passage of the Affordable Care Act in 2010, we've leaps and bounds in ensuring that number of uninsured has decreased in this country. So the cuts, work requirements is the one that we've been hearing a lot about. And this is mandating that adults who are eligible for Medicaid expansion meet the new and burdensome, reporting requirements. That's number one. We can talk a little bit more
Mhm.
about that because that seems to get the greatest buzz. The second is on there will be more frequent eligibility redetermination. So it's been a process of having to apply each year. Well, now there's going to be more frequent eligibility checks to ensure that the people who should be on Medicaid are getting it, and those who shouldn't be on it will be disenrolled.
Mm.
Um, there will be a repeal of much of the Biden administration had put forth in terms of streamlining eligibility in the enrollment processes. Corey, I'll say in another life, I was served as a social worker in inner city in St. Louis, and did work in helping people enroll, and it is a cumbersome process. And so to put more loopholes here will only have a greater opportunity for people to make mistakes,
Right.
not get paperwork in, the whole host of things. So that's really concerning. Two other issues that are bubbling up quite a bit. There will be a limit in provider taxes and state directed payments. And I will say, those get into more technical, financing mechanisms, but it will really restrict the state's ability to pay for it, basically, right? I said it's a split program between the state and the government. The states have to figure out how they're going to pay their half. And these are mechanisms that will enable them to do the financing for Medicaid in their state. Um, they're going to curtail what we call retroactive eligibility. So if someone comes in, shows up in an emergency room, they're uninsured, there will be some assessment that this person would be eligible for Medicaid. We're going to put them on Medicaid. And we're going to
Right.
go ahead and work as this. And so they're going to do some restrictions in our ability to do that. They're going to shorten the period for which individuals can receive Medicaid coverage for those past medical services. So that will be a challenge for our providers and our hospitals. And one thing that's not getting talked about, but I think we need to elevate, is that they're going to eliminate the incentives for states to adopt expansion for the Affordable Care Act that's in there. And so we know that many of our states have been expanding Medicaid.
Mhm.
They're going to eliminate um, the incentives to encourage states to do that very thing. So that's a laundry list, and as you can see, it's a battle to deal with each of those challenges.
It sounds like to me, Sister Mary, it sounds like it begs the question to ask, and you don't got to answer. But for me, it's like, who is this benefiting? Fitting. It doesn't sound like this
Good
is
question.
benefiting anybody uh, with all the things that you talked about and that we're hearing about around, these cuts, and it just begs the question of like, well, why, why are we doing this? So and that kind of does lead to my next question is this, why is this issue, and you kind of really said it in your last answer, the urgency of the right now. There have always been questions, and the topic of Medicaid I feel like has came up over years, but right now it feels like there's more of a sense of urgency now more than ever. Can you kind of talk about that a little bit?
Yeah, I've been thinking a lot about this one. In my estimation, whenever anyone loses health care, it's an urgent situation
Hmm.
to get them enrolled because, you never know, right, when you're going to need it.
Right.
And so I want to say this urgency is because healthcare is a critical lifeline. We know that we have access to primary care, to acute care, to those essential services that we need, and to uh, 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 consider all these potential cuts that will have negative impact on those who are currently covered, I think it's unconscionable to think about that. So, as I said earlier, Medicaid really is a lifeline. People depend on it, and we know that people who are low income, who are more challenged in a variety of ways around social factors, whether it be on housing or whether it be employment, a whole host of things, that's critical lifeline for them to ensure that they at least have health care. And I would say, Corey, again, I've worked as a social worker years ago. I've seen situations where people were just one paycheck away from, being on, being on supplemental
Yeah.
services, being on, food stamps, being on Medicaid. So it's urgent, it's concerning, and it's, as I said, unconscionable that this is happening now in our country.
Yeah, and the CBO estimates that over and I'll make sure I have this linked in the description of this episode, but the CBO estimates that over 10 million people could lose Medicaid coverage.
Yeah.
Who are the people most at risk?
Right, right, right. Well, as I said, nearly 80 million people are actually enrolled,
Mm,
so, consider that. So, 20% of the US population is on Medicaid. I mean, one in five individuals, 36% are children, 10% are disabled. Those are the ones who are going to be impacted. I said at the introduction that 41% of all births are on Medicaid, so nearly half the
yeah,
children with special health care needs. We're going to see our seniors, our nursing homes. The Medicaid covers nursing home care. And so that's the primary payer. And those folks are going to be impacted. And I think it's important also to note that when people lose coverage, they still get sick. It's not gonna stop them from
right.
showing up at the hospital, the emergency care, and what's gonna happen, they're gonna be sicker when they get there because they didn't get the primary care they needed, or they held off on going because they don't want to accrue high, medical debt. And so our ERs are gonna be more overcrowded than what we see now because people are going to go back to using the emergency department as their source of primary care.
Yeah, that is a point I have not heard a lot, and that is so important. Our emergency rooms, as I'm sure you're aware, are already doing way more than what
Right.
they should be or are capable of, and this has the potential to really make things a whole lot worse.
Right, 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 right.
Um, what do you say to those who believe and you kind of talked about some of the kind of the overview of the cuts, but what would you say to those who believe the work requirements will reduce dependency rather than coverage?
Yeah. Well, I think we need to delve into this whole notion of these, who's actually not working.
Mm,
We're seeing a lot of reports that saying this is being overinflated, that unemployment rate in this country is at the lowest it's been in more than 50 years. And so, I tend to think that these work requirements is, it's trying to solve a problem that doesn't exist, to be quite honest
mm,
with you. And I think it's deflecting people because everyone would say, of course, everyone should have a job. They should be gainfully employed. And we go back to this, we're not giving handouts. Well, I would say that this is, not the issue. It's being, communicated. And,
right.
I also believe, and I said this earlier about some of the, the processes, it's going to become more burdensome and it's going to require more paperwork multiple times a year. And it's actually, going to perhaps only focus on a very small percent that may not be employed because they're taking care of children. They don't have
Mm,
daycare. They're taking care of elderly parents. And so, how do they manage that? So, there are other, and I said that earlier about social issues that are impacting people who are poor that we're not thinking about in terms of the full understanding of, what's happening in their lives and how do we help individuals manage it. Because you take them out of the household and say you've got to go work, then what's going to happen to those children and those elderly who are in need of care? So there's a ripple impact there that we'll be see happening.
Yeah, is going to just make things worse for vulnerable populations. I will say so far doesn't sound like there's a whole lot of light at the end of the tunnel, but this is something that's super important. And something that I heard too and read is some states could see enrollment drops as high as 26%. How are state governments expected to manage such drastic changes?
Yeah, yeah. I think that's going to be the challenge is because states have finite resources. They have a certain number of limited resources. And so we're going to start to see a lot of, cost shifting. And they're going to raise taxes or else they're going to cut services.
Mm,
One of the two. You don't have a lot of options here in order to maintain coverage in these Medicaid populations. So, this is also going to disproportionately impact states already who have limited budgets.
mm,
Look at southern states. You can pinpoint some of those. And so what we're going to see in this country is a real exacerbation of regional disparities in healthcare, across the country, just because of limited state budgets. The money's got to come from somewhere. Only two
right.
options: cut or raise taxes.
Right. Which, I don't think a lot of people really understand. I feel like those that maybe be in agreement don't understand that this is going to affect your pocket in some way, regardless if you're on Medicaid or not. If this goes the way that, it's going so far.
Yeah, yeah, Corey, absolutely. If I can just, say a little bit more about that, I think, if we think this is only a problem for people who are on Medicaid, we're
Yeah.
we're foolish because it's going to have a ripple effect. If people are going to come for care, and we're going to provide care for all, Catholic health care, cares for everyone who comes to our doors, and so those, those costs are going to have to be, covered somewhere.
Right.
So we're going to see overall costs go up for all people, not just the impact on people who are on Medicaid.
No, that is so important. I 100% agree. Um Can you tell me a little bit how would these cuts affect the ability of states to fund, basic healthcare services? And you kind of talked about that too. It kind of makes it a lot harder.
Yeah, yeah, yeah. So, some of the things that at least I'm going to again speak from my perspective in Catholic healthcare. We're recognizing the fact that healthcare is just not about primary care. Go to your doctor once a year and go to the hospital when you're sick, right? So we have to look at all things that impact our health. you
Hmm.
know um, what we call now are the social determinants of health. We know people who don't have access to safe housing will have an impact on their health. People who don't have healthy foods will have an impact on their health. So all of these things that we've recognized that are now an important piece of the whole healthcare picture will not be paid for. We're not going to be able to do services we've done in the past, and even around, let's use maternal health. So
Hmm.
we have, again, it's unbelievable, high, maternal mortality rate in this country. You think a country like the United States, and people of color, women of color, are dying in childbirth.
Yeah.
Why is that? And so we've employed a lot of programs through our members around addressing the maternal health crisis in this country. Those programs aren't going to be, able to be sustained in a long term if we have to focus everything back on acute care services. We've also employed programs such as PACE, all-inclusive care for the elderly, home-based programs that are so important, particularly as we see a growing senior population in this country. Dental services. I mean, people will think, what's the importance of that? I'll tell you this, when I worked in the hospital, I saw the number of people who came in with systemic infections because they had poor oral health care.
Man, so
So
important.
it's so important. So we have to understand all those types of things are going to get cut as a result of this.
Yeah, it is a ripple effect for sure. Um, something I'm curious and I would love your input on is, how might these changes impact employment in the healthcare sector?
Yeah. You know, we certainly know that hospitals are anchor institutions,
Hmm.
and so we employ a lot of folks within healthcare. And so if we're starting to see services being cut, hospitals closing as a result of this, which could happen, that's going to have certainly an impact on those employed in the healthcare industry. So it will again have a ripple effect, and we're going to see those types of impact are going to happen more, I would say, in rural communities and underserved communities. We saw it with COVID, Corey. We
Hmm.
saw that as a result of the stress on our hospitals during COVID and thereafter, it had an impact on their abilities to be able to continue a healthy financial
Correct.
balance sheet.
Right.
Yeah.
Right. And now, this it leaves the potential now someone may have to drive even further just for the simplest of care. Um,
Yeah, yeah. I was talking with a CEO in South Dakota yesterday, and she was saying because of some of the challenges that they're having, that in some areas, women have to drive 2 hours for pregnant women have to go two
Oof.
hours to their prenatal visits.
Wow.
Yeah.
Oh my gosh. And um what would these cuts mean, Sister Mary, what would they mean for, Catholic health systems and hospitals around the country?
Yeah, yeah. Well, Corey, this gets at the very heart of why Catholic healthcare exists. When I said the sisters came to this country in 1727 to care for people in need, and we've continued that. So, it will really it strikes at the heart of our mission, and what will we need to do? And again, we recognize that we have finite resources. We have a certain amount, of ability to be able to, care for a growing need.
Hmm.
And so this will jeopardize our ability to provide essential services, to keep these clinics open, our hospitals open. So we're going to have some serious work to do to figure out what exactly will have to cut, what will we be able to do in order to continue our mission. And I think we've gone through critical points in our history. It may not be around funding cuts. It could have been around many, many other things. But we saw ourselves through it because we're committed, and we're going to be here in the long run and the long game.
Yeah, and I love that you said that about, being your commitment. And I'm curious on, what is, CHA doing to push back against some of these proposals?
Yeah, so we have always been, it's been part of our mission, and certainly part of our strategic plan through the years, that Medicaid is essential. And so we have, probably maybe around the time of the ACA, had put forth a plan called Medicaid Makes It Possible campaign,
Mm.
where we create a lot of advocacy tools for our members to utilize to ensure that Medicaid is protected. So that's ongoing work that we've always done. We bring our members together for fly-in days to Washington, D.C., where we help educate, give them the tools they need. We go to the Hill and make visits and really try to educate. I think it's all about educating people. I don't think they would understand the whole complexity of this because it's a very complex industry. We've engaged our religious sisters, in basically telling the story. I
Mm,
think they can be quite persuasive. And because they are religiously vowed women, they carry a certain amount of um, um, the moral voice, I would say, of the church. So I think that's important that people do believe them. I want to say we work closely with the Catholic Church as a whole, with the Bishops' Conference. We also, I'm very pleased that this year that CHA had been elected chair of the Partnership for Medicaid. And that coalition is comprised of 25 organizations representing clinicians, healthcare providers, safety net plans, and we're leading that charge. Corey, yesterday we just had a press briefing.
mm-hmm.
We've been doing virtual press briefings the past month, and again, trying to get the information out to the media because that's key. So, host of things are being done by CHA.
Yeah, so I mean, it sounds like all the people that need to be at the table are at the table trying to make this happen. Uh, but also, thinking about that, what can a concerned citizen do to get involved? Is there something that someone that's not in the health sector or public health sector or whatever, but they are passionate about in keeping their communities healthy? What can they do?
Right, right, right. Well, I want to say this past weekend, we saw across our country what people can do when they
Right.
gather, right?
Yeah.
And so we need to keep speaking up. We need to make sure our voices are heard. And I want to say when elections come around is when politicians will come to the local area and want to get the vote. So let's hold them accountable to what they said they would do for us. And they need to hear from us. And so I think there's a lot. Oftentimes I talk with people and they say comments like, well, uh, I don't know how to, I don't know what to do. They feel helpless. If we get complacent, we're complicit. I
Mm.
think we've got to get involved.
No, 100%, 100%. If you're not saying anything, you're not using your voice, that's what you got, right? You
That's
got you
right.
gotta use your voice. You know,
That's right.
Sister Mary, we talked a whole lot about what's wrong right now.
Yeah.
Tell me, what gives you hope right now, in the middle of all of this?
Well, Corey, I say to people, we live in hope, and our late Pope Francis claimed this year as a year of hope in the church and in the
Mm,
world, and um, I often wonder how people who don't have faith keep going. So I'm going to say that is the anchor for me personally in terms of my faith. But I also think it's not just faith in my God, it's faith in people. I mean, we've got remarkable people across this country who have been, leaders on the ground. They may not be known in Washington, but they're known in their local communities. And the
absolutely.
work they do, day in and day out, ensuring justice. I think I stand in awe and admiration of them. So, uh, I reference what happened this weekend with protests across our country, and I'll say majority were peaceful protests. That gives me hope when people start to get engaged, when people are able to take responsibility for their neighbor and say, we are about this together. In Catholic healthcare, we often talk about two pillars being, respect for the person, human dignity, and the common good, that we come at this together, that we are individually, the whole is only as good as the individual. So we come together and advocate for those in need, and I think that is inspiring and gives me hope.
No, that's real, and I'm gonna leave it at that. I don't want to add. I can't add anything else to that. Sister Mary, thank you so much for being on the Healthy Project with me. For anybody that wants to learn more about CHA, about you, or or stay connected to what's going on, where can they reach out to?
So go to our website, chausa.org, and you will find a ton of information. You'll find ways to access me, our advocacy staff. I just would invite you to reach out.
Awesome. Again, Sister Mary.
Corey,
Sorry, go ahead.
yeah, I want to say again, thank you for all you're doing and giving a platform for these critical issues. I'm very grateful.
Yeah, oh, 100%. I feel like this is the way I can use my voice and allow and amplify others. So I am about that life 100%.
Wonderful.
Again, thank you so much for being here. And everybody, thank you so much for listening and watching the Healthy Project podcast. I'll holler at you next time. Hey, thanks for joining us on the Healthy Project podcast. At Healthy Project Media, our mission is to connect with the next generation of health leaders and innovators. If you're interested in advertising with us or exploring collaboration opportunities, please reach out at hello@healthyprojectmedia.com. We look forward to growing this community together. Until next time, keep pushing the boundaries of health.